The academic day offers an opportunity for professionals and students within the SAMs to present their hard work of research throughout the year. On these days, we expect to receive invaluable input from colleagues about how to strengthen our work and disseminate that experience and research that we have gathered in our field of study. After going through the program, let me say I was impressed, and I'm looking forward to the discussions and encounters of the academic minds that we have within the SAMs over the next 3 days. As healthcare practitioners, it is imperative that we use this valuable opportunity to broaden our intellect and continue to learn as required. I also trust that through the initiative like the SAMS Academic Days, the South African Military Health Services healthcare providers will take their rightful place in the health cycles in South Africa and around the world. I therefore am pleased with the theme of this year. I quote, "Towards military health excellence," close quote. This theme was adopted by the SAMS Command Council, and we launched it in 2023 as part of the Surgeon General's intent for the next 5 years. This theme is in support of the Chief of South African National Defence Force's journey to greatness. The excellence models that aims to enhance the military health service delivery and performance excellence informs this theme. The chasm between the healthcare we have and the healthcare we should have is growing wider. And therefore, proper research is necessary in order to close that gap. In this regard, improving healthcare quality is everyone's business, from the healthcare providers to the management, to all support members and the networks, not forgetting the community we serve. It is important going forward we speak the same language and have the same understanding of concepts of healthcare improvement and continuous research, and enjoy the rest of the conference. I hereby declare this conference open. Thank you.
South African Military Health Service, towards military health excellence.
So what I was discussing today is basically CHA in terms of the main issues that affect basically the CHA status, and it boiled down to predominantly lifestyle diseases, and which is something that happens over the period of employment all the way to end of employment with the military. And so I highlighted high blood pressure, I highlighted obesity, I highlighted diabetes as some of the big issues that are affecting CHA, and they are predominantly lifestyle linked, and that's why as an organization we need to adjust ourselves to help our members and also to prevent such things from happening.
So I was basically presenting 2 papers at 2024 Academic Week. Number 1, it was the flaws and the limitations of BMI in diagnosing obesity. Then number 2, it was the knowledge, practices and attitudes of uniform members on CHA, PT and fitness tests. And it was quite a very informative and experience for me, and I think it is time for the organization to re-engineer itself pertaining to how we do things.
And I was here presenting on the evaluation of BMI as an indicator for obesity among female soldiers. And I really tried to highlight the need or the benefit to consider additional measures of body composition, more direct measures of body composition to be integrated into the criteria. So far, my experience of the SAMS Academic Day has been very informative, and I've really enjoyed the other presentations, and I found that they tied in very well with some of the research that we are doing as well.
South African Military Health Service, towards military health excellence. South African Military Health Service, towards military health excellence.
Good day, I'm Corporal Lenzwe, and I just presented my master's project in epidemiology, and I looked at the epidemiology of escape pathogens and Clostridioides in patients with and without COVID-19 around hospitals in Gauteng. And I presented this study at the SG's Academic Days. I'm based at SAMS Research Unit, and this study, fortunately, it's one of the studies that are accepted to be presented at the Global International Conference at Canada in Vancouver.
I presented a study which I was basically conducting at one military hospital under the topic utilization and implementation of antibiotic prescription chart within the South African Military Health Services with the aim of enhancing antimicrobial stewardship within the SAMS. So this came about because of the increase in resistance in antimicrobials within our SAMS, and I do think that the utilization of the antibiotic prescription chart is going to help enhance our stewardship programs and also reduce the resistance to antimicrobials that we're currently having within the SAMS. It was my first time presenting at the SAMS Academic Days, and I was very nervous, but I think it is a big platform where one can grow, and I think it is a very good way of actually presenting our studies, and hopefully they will be implemented, or any recommendations or changes that we want will be implemented within the SAMS. Thank you so much.
South African Military Health Service, towards military health excellence. South African Military Health Service, towards military health excellence.
Ever since I became Surgeon General, I've attended 2 international Congress of Military Medicine conferences, and the presentations here are nowhere anyway less than what I've seen. Your presentations are there, if not above that. The theme of this academic week was towards military health excellence, and I think we've achieved that. The participants, your participation as well as the engagement while seeking clarification from the speakers have kept this conference very interesting. The past 3 days has set us to a new path towards the provision of quality health care for all our patients. The path we have chosen is irreversible. We are at a point of no return. We must be bold and focus to intensify on the chosen theme towards military health excellence. The aim that aims to enhance military health service delivery and performance. Now, all in all, I want to say I'm very pleased at the conclusion of this academic week, and we're looking forward to next year. At the end of this, we will choose a winner. I'm told the previous two days there were 3 evaluators, and today there were 2. And these people went through all the presentations, and they came up with winners. And therefore, the winner of this year Code 74 is Corporal T.I. Lindsay.
Corporal Lindsay from SAMS Research Unit and SAMS Academic Days 2024 winner, and I'm overwhelmed. I'm over the moon. I was not expecting this, as we were presenting against medical doctors, the specialists and the nurses who've been in the field, and I'm still new in the field, and I was not expecting this at all. It was the first time presenting my master's project in SAMS, and it was not easy. I was a bit anxious, but yeah, I managed to pull through. And the name of my, the title of my study was the epidemiology of escape pathogens and Clostridioides in patients with and without COVID-19.
South African Military Health Service, towards military health excellence.